Good afternoon all. Today I am here to present my paper on strabismus surgery in the elderly, results of objective and subjective analysis. So, strabismus or misalignment of eye can occur at all ages, affects 4% of the adult population, and many of them are under misconception that there is no effective treatment for the same. But the strabismus surgery in adults can improve both functional as well as psychosocial aspects. This can be classified as committant or incomitant. Committant can be pre-existing or acquired developmental. Incomitant can be paralytic or restrictive. So this strabismus can result in diplopia, visual confusion, reduced visual fields, abnormal head posture, psychosocial effects, and poor quality of life in elderly, apart from the cosmetic blemishes. So aim of our study was to objectively and subjectively analyze the functional as well as psychosocial changes in elderly before and after strabismus surgery. So this is a prospective study including patients equal to or more than 60 years who underwent strabismus surgery, and all these patients underwent strabismus surgery with fixed absorbable scleral sutures, and the study was from Jan 22 to Jan 23. Informed consent for the study and 9 case pictures were taken from the patient. Ethics committee clearance obtained. So all these patients underwent a complete ophthalmic workup and a detailed strabismus workup. An objective score is calculated using the following parameters: the presence or absence of manifest squint. BSV for distance was calculated using the Watford dot test. BSV for near calculated using the stereopsis, and then graded accordingly with a minimum score of 0 to maximum score of 8, which indicates more functional disability in patient. Subjective analysis done using a written questionnaire, which was the modified AS20 questionnaire, and there were 10 questions preoperatively, and patients were response were noted from never, rarely, sometimes, often, and always, and given a score from 0 to 4. 4 indicates worst outcome or more functional disability. This is one of a sample questionnaire, one patient response. Similar questions were repeated post-operatively and score were calculated from 0 to 4. 4 indicates more poor outcome. Patient's response after surgery. So total 16 patients, 12 were males and 4 females, out of which 15 had exotropia, 1 had esotropia, another one had esotropia with hypertropia. And 93% of patients opted for surgery because of functional reason rather than cosmetic. 75% of these patients had an decompensated phoreatotropia. Remaining had a restrictive squint and recovered paralytic. All these patients achieved good cosmetic alignment for post-surgery. 62.5% achieved good fusion and 43 achieved excellent stereopsis. So this is a graph showing the objective and subjective score. There has a significant reduction from 87 to 37 in objective score. This 87 indicates more functional disability. And subjective score, similarly, there is a significant reduction post-operatively. So this is the objective and subjective score mean. There is a significant reduction in post-surgery with significant p-value indicating a good clinical outcome. So although many studies have used questionnaire, there is a positive study which compare the objective and subjective score before and after surgery. So when considering this objective score, it is well understood that there is a successful restoration of binocularity. Surgery also successful in eliminating 88% of diplopia in our study population without any unusual complications. Persistent redness was a concern for 2 patients. So this is a graph showing improvement in quality of life in almost all domain after the surgery. So these are the images of some of our patients who underwent strabismus surgery before and after surgery. As you can see, all these patients had good cosmetic alignment post-surgery. So to conclude, strabismus surgery in elderly significantly improved the quality of life both functionally and psychosocially. But limitations, long-term follow-up is needed, relatively low sample size, other confounding factors. These are my references. Thank you.
Anju, right? So that was most of the things were right about this. Some things which could have been improved are, one is you could have added a review of literature. That was completely missing. Okay, so there are certain prerequisites for every paper to be complete. So one of them is a discussion based on a review of literature. So that was a major flaw in this paper. And another thing, if you had added a review of literature in this, I don't think you will find any paper which says that strabismus surgery does not improve the objective and subjective outcome.
Actually, no studies were there comparing.
That is why there are no studies. Because we all know it does improve. Okay, so that is a known fact. So, but what is relevant here is how in your center and in your hands, what is your result? So, this paper should have been our experience with strabismus. Because there is no confusion in the other aspect. That is why we are doing surgical correction. There is a subjective and objective improvement. But each center has a different experience and each regional differences may be there. So we have in this paper, the only idea there is to explore those differences. So if we want, I'm interested in knowing how this is working out in another state or another country. That is in the relevance of your study. So that section should have been added. You can still add when you send for publication.
Okay.
Thank you.